Well, hello world. Dr. Lucas McGuire here, McGuire Orthodontics and Facial Orthopedics. I wanted to record another video, and today's topic is children, ADHD, hyperactivity, how that can relate to their mouth, their teeth, and their airway. So I wanted to just take a couple minutes and describe to you those connections. So you got kids that are wild and crazy, bouncing off the walls, can never seem to sit still. The teachers have a challenge with the kids. They recommend seeing a physician or a pediatrician to assess their attention. The term ADHD, attention deficit hyperactivity disorder, is thrown around. Medications are discussed. When what we know now in our medical and dental literature is sometimes if you dive a little bit deeper and we wonder, how is your child, for instance, sleeping at nighttime? What we know is the airway and the nasal passages and all of our structures that brings the oxygen to our tissues. If we're not able to bring that oxygen, we are depriving our bodies of that wonderful elixir. We are arousing at nighttime. We are potentially wetting the bed. We are not getting a complete night's sleep. Now, if we compare that to an adult, for say, if you don't get a great night's sleep, you wake up feeling groggy, you maybe have to caffeinate, take some stimulants, some supplements to help wake you up and get you through the day. In children, it's a different type of reaction where their bodies overproduce hormones that now overstimulate them. So a child that is hyper or hyperactive or unable to relax, their body may be telling us that they're not getting the appropriate amount of sleep, so they're actually overtired. And their body is overreacting and stimulating them more than they should. So before we medicate all of our children that are a bit hyper, maybe we ask a couple different questions. Maybe we investigate how they're sleeping at nighttime. Maybe we're wondering why they are 7, 8, 9 years old and still wetting the bed, or waking up with nightmares and wanting to come into mom and dad's room to sleep. So maybe this is your child. Maybe you are struggling with having them get a full night's sleep, but then also struggling with their hyperness during the day. Medication may not be the answer. In some instances, it may be. But I know as a parent myself, I would want to ask all of the questions first before jumping to a medication that may not work for my child. So reach out. We're here to answer any questions. We do offer virtual exams just to be available for our patients. If you're watching this in the future, we're currently under a coronavirus lockdown, so we are not seeing patients currently, but soon enough we will be able to evaluate all of these potential challenges for yourself or your child, and we'll be able to take some very in-depth photographs. We'll be able to take three-dimensional images to see how orthodontics can improve the structures that help you breathe to help get you that wonderful, beautiful night's rest, so we can all wake up refreshed, ourselves and our children included. So if you have any questions, I'm hoping this video helped to bring to light a very important issue. I know it's brief, but we will be having much more information in the future as to higher details and diving deeper into this very important topic. But for now, this was a nice appetizer to get the discussion flowing, and always reach out with any questions that you have. McGuireOrthoCLE.com, LDM@McGuireOrthoCLE.com is my email. Give us a call. reach out, follow us on our social media platforms. Any conversations that you guys would like to have, reach out. Have a great day.